Hi, everyone. Very warm welcome, and thank you for joining us for this final panel of the Virtual Global Forum on TB vaccines. And thank you to the ambassador for her video remarks just now. Let's go ahead and get started. I'm Mike Frick. I co-direct the TB project at Treatment Action Group, and I'm speaking to you today from my home in New York. I'm very honored to be co-chairing today's panel alongside Glaudina, from the South African Department of Science and Technology. And here's how today's program will run. I will momentarily turn things over to Glaudina to introduce herself and to offer a few introductory remarks to frame today's conversation. After her introduction, we'll bring in our esteemed panel. We'll introduce each member of our panel as we ask that person first an initial question. We do want this to be participatory, and so we encourage you to submit questions to the panel using the Q&A feature on Zoom. Glaudina and I will be keeping track of those questions, and if you want your question answered by a particular panelist, you need to let us know when you submit the question. Otherwise, we'll do our best to farm it out to the appropriate person. And we've also encouraged our panelists to ask questions of each other. So there may be a certain amount of talking over each other or interruption, and that's to be expected and maybe even encouraged today. So before handing over to Glaudina, let me give just a few comments of my own. The panel topic is closing the financing gap for TB vaccine R&D. So I think it's important from the outset to understand how sizable that gap is. We know that in 2018, UN member states committed to raising $2 billion a year for TB research. And within that $2 billion annual figure, the Stop TB Partnership has called for spending at least $600 million a year on TB vaccine research. We are very far from accomplishing these goals. Data from Treatment Action Group and the Stop TB Partnership show that actual funding for TB research is about 1/2 of the $2 billion level, and that actual funding for TB vaccine research last year in 2019 was only $116 million globally. Over the past 11 years, we've spent just over $1 billion on TB vaccine R&D. Over that same period, the world spent over $9 billion on HIV vaccine research, and in just 11 months, the world spent nearly $87 billion on COVID-19 vaccine R&D. So with this financing gap defined and with that scale in relation to HIV and COVID in mind, I'll now give the mic to Glaudina to introduce herself and give her opening thoughts. Over to you.
Good day. Sorry about that. I'm sitting in a hotel room and they're insisting on talking to me. So, Glaudina Lewis, Director of Health Innovation, Department of Science and Innovation, South Africa, and I'm talking to you from Durban in KwaZulu-Natal, South Africa. It's an honor to co-chair this last session of the forum with Mike, and I'm looking forward to listen to our esteemed panelists for their guidance on how we're going to finance this absolute gap that we need in order to get to a TB vaccine. Since the onset of SARS-CoV-2 pandemic, it's been clear that if the world pulls together, we can get to a point where we will actually find vaccines that can be rolled out. And we need to look at what are the highlights and the lessons learned from the COVID-19 pandemic, and how can we then utilize that going forward to find a TB vaccine? But let's listen to our panelists and let's welcome our session panelists for now. Thank you.
So bringing in the panelists and getting right to our first question. This one is directed toward Dr. Luchika Detieu. Luchika certainly needs no introduction from me and is known to all of us. She's been the executive director of the Stop TB Partnership since May 2011. Is a Romanian physician and public health expert and leads our global advocacy charge to eliminate TB. Luchika, the question for you is, the TB vaccine field has identified this increased funding as a longstanding central need. We've called for greater investment for years. It's basically the refrain to which we wake up every morning, and yet funding for TB vaccine R&D hasn't increased substantially over the past 10 or 11 years. So my question for you is, what do we need to do differently to be successful at closing this gap? And in particular, what do we need to do differently in our advocacy and our political work? And what have we been doing wrong all this time? So over to you, Luchika.
Yeah, so thank you so much, Mick, and also Glaudina. It's actually the honor is for me to be part of this panel, and also I am so impressed with this 3 days of discussion around the TB vaccine, even though I have to confess that I spoke with people that, we have this session about this, and every time I mention to TB community people saying about the TB vaccine, everyone says, oh, you don't have a vaccine yet. And when I started explaining, but do you really need a vaccine? So it's a long way to go. Like when you ask that, my blood, even now before the session, I was speaking with someone who actually specifically asked, but do you really need a vaccine? So you're absolutely right, Mike, that we accepted for too long a status quo that I think I can call it pathetic in the terms of funding for R&D and funding for vaccines. And I think we were shy because I think in our heads was that, there are no funds, people need to prioritize, you know what I mean? I think we were, and I am afraid we still are, a very decent community. And I think that what COVID learned all of us is the fact that actually, if there is a will, if there is a fear, the world finds the money and is able also to come together shoulder to shoulder to develop a vaccine, as you rightly said, comparing the COVID vaccine with what we have for TB. So, I think that what we should do different, you see, and when I say we should do is related very much to what funding and capacities we have, because, and also I have to say it has, there is an issue with which populations are actually suffering more from COVID and from TB. And if you look at where the big numbers in terms of COVID deaths are, you will see that it's a lot in the north part, in the high income countries. And then the places where TB is are actually the places in which there is limited COVID vaccine. That's what we overlap with. But you said, I don't want to go into many circles here because you asked very, very concretely what we should do. And my point is, I think we should be, first of all, extremely united and extremely vocal. And we should maybe stop this dichotomy that we had between implementation and research. And we should speak about the tools that we need in general to end TB by 2030, for which, let's recapitulate, it will not happen if we don't have a vaccine. The second is, I think we should not, we were going incremental and we were saying we need 2 billion, let's see over that and that. I think we saw now that it's possible that you do develop a vaccine by going in parallel. You don't need to do consecutive steps. You can do several of them in the same time. And that it's possible to mobilize billions. So I think we should not accept anything less starting, I was saying, nothing less for TB. And we should demand something that I saw also the Minister of Health of India was requesting as well. We should demand that we have a vaccine by the end of 2023. I don't think we should accept, and that should be our tagline. We need a vaccine for TB by 2023, and we need the resources for that. And we should not accept the status quo. And that should be the tagline and everything that we should all go underneath. I know that we have all different agendas, but if we are serious about it, if we don't ask for this, we will go to our, sorry to say, lame time frame, expecting to have a vaccine in 2027, which is like, if you speak with people these days that saw how quickly COVID was developed, it's difficult to explain. My son, who is 19, he cannot understand that we worked more than 12 years to be where we are, and we look at additional 5 years till we get the vaccine. He cannot, he says, but that's impossible. So my point is, can we not only be united, but be outraged in our reach? And the second is, which depends a lot, not the second is, and another big point is this: people don't know that we don't have a vaccine. People don't know how much we need a vaccine. To make communication work, we need to invest in communication for these topics, which was, as you know very well, Mike, because, and all of us here in the panel, for a long time, we tried to do that. This is my last point, just to clarify. We never have the luxury of having the budgets to really do solid, good communication and awareness campaigns that people know that we don't have a vaccine. You know what I mean? That we should not have global health people asking these questions, because that was my conversation, was not with somebody producing a car. So we need to have some very solid communication campaigns focused solely on that, and just go and go and go. Last point, actually, I want to say one thing. We can be also, so we need to learn from COVID. And if the world saw that it's possible for COVID, it must be done for TB as well. Full stop. The second point, and then the other point is that, you see, we can help with the TB platforms with the delivery of the COVID vaccine, which will position us, because, helping with the delivery of COVID vaccine in the communities. The community health workers and civil society networks that we have and created for TB can actually help with the COVID vaccine. And if we do that, even if we start in some countries doing this and schmoozing and facilitating that, it will be extremely important preparing the ground for us, but also understanding more what are the barriers for people to get vaccinated and so on. This is a sort of collateral thing, but as time is passing, we should put a foot on the door on this aspect as well. Thank you, Mike, and sorry that I spoke a bit too much.
No, not at all. That was very concrete. So we heard accept nothing less than billions, accelerate the timeline to 2023, work together and rely on our community networks. And I think those are all themes that we'll return to. Glaudina, you're introducing our next speaker.
Yes, the next, our previous speaker spoke about countries where COVID is very rampant, but a country where it's not only COVID, but other extreme important things such as TB, and where you have the sort of joint happening of that, apart from South Africa, is actually India. And so our next speaker is Dr. Manjula Singh. She's a scientist E from the Division of Epidemiology and Communicable Diseases at the Indian Council for Medical Research. She is the coordinator for TB research activities for the BRICS TB Research Network, that is including South Africa, India, Brazil, and China. And she is also involved with making sure that we actually be able to work together. So she's a key person for that. And I think let's ask Manjula, what do you think needs to change so that governments can actually, in high TB burden countries, can lead, setting the agendas, financing, so that we can get to new TB vaccines? Thank you.
Thank you, Claudia and Glaudina and Mike. And thank you for the opportunity to be on this panel. So in terms of what needs to be changed so that the governments in the high burden country can lead the financing in the research agenda, I think it is the approach. It is the approach that we research organizations and the people who are actually leading the research, the TB R&D, approach the government. So a detailed research agenda, a detailed plan is needed so that you can approach the government. I'll give you an example. Like in India, India has the highest number of TB cases in the world. Of course, in the BRICS itself constitutes 50% of the TB burden. And India shares quarter of the TB burden. And so India established, like ICMR established India TB Research Consortium to fight TB, to tackle TB in a mission mode. And what we did, we prepared a detailed plan, a detailed research agenda with, in all 4 thematic areas of diagnostics, therapeutics, vaccines, and implementation research. And with that agenda, with that plan, it was presented to the Government of India. And the Government of India dedicated that, allocated dedicated funding for TB R&D. And we got, first phase was over, we got about $23 US million grant for 2 years. And after that, the phase 2 was recently approved. So that really showed, that our detailed agenda and the plan is very important. And then we were able to start a phase 3 TB vaccine trial, which is a prevention of disease trial in the country, with 2 vaccines being compared against placebo. This one is recombinant BCG VPM1002 and other is MIP. So entire funding was provided by the Government of India. It was because we had a detailed research plan. So and this India TB Research Consortium was also connected to the BRICS TB Research Network. Now, this network again can be utilized, for this global TB R&D, because TB R&D is a global need. We need global leaders who can connect and present the plan to the respective countries. This is what is needed to change. We have been having, uncoordinated efforts, everybody trying to do it, trying to consolidate, but probably, not having the right mechanism. Another example I gave was a global TrueNAT validation study, which was coordinated by FIND. There was some funding issues with the FIND, and then when there was a discussion, DG ICMR became a co-sponsor, and we funded, the Indian sites for this global study. And as a result, the TrueNet was, this was a part of WHO pre-qualification process. And as a result, TrueNet was validated and WHO recommended it. Now the entire world has another molecular test, while earlier we only had gene expert. So these two examples show that with a detailed plan and agenda and a discussion, we need one dedicated organization in each country which could connect the entire country's efforts. Each country has multiple organizations, institutions, non-government organizations working towards TB R&D. So what is required is a consolidated effort and a global R&D team. We could have a core group. We could connect all the stakeholders around the world. But then if you don't prepare an agenda, if you don't prepare a plan, how are we going to ask funding for? Take an example of COVID. What was there? Everybody started working on the agenda, how to develop a vaccine. A protocol was there, the sites were there, the training was there, the capacity building was there. Everything was done simultaneously together. And coming together when it was presented, and every government had put in, funding for this. So similarly, with this example, I totally agree that globally the TB R&D funding has not increased, but in India has seen consistent increase in TB R&D funding. Mike has been collating the data each year, and it has been a substantial increase, I would say, in TB R&D. So this is an example. This is an example where which we can actually lead. This is a live example, I would say. We are living that example. We have been leading the phase 3 clinical trial, multiple clinical trials in therapeutics, validation studies in diagnostics, and of course, preventive therapy is the must. So vaccine is a must, and this needs a huge funding. So I think the collaborative efforts and then presenting the agenda to different countries. So each country will be able to fund their own respective sites, because this mechanism exists in each country. There may not be a mechanism to fund cross-country, sites, but that is why the global agencies find it a little difficult to arrange for the, funding to fund all the sites across country. So let us have a, collaborative mechanism where each country funds its own sites, which are of course are involved in clinical trials. And since maximum burden lies in the BRICS countries, and these are the countries who have been participating globally in various clinical trials, whether it's HIV or whether it's for TB or it's for including COVID. So if the burden lies there, the sites are, trained, they have the capacity, they are ready to, fund. So what is required? What required is a dedicated plan, the agenda, which could be presented to the respective countries with details. Well, this is the site who would conduct the TB R&D. This is the vaccine. This is the sponsor. This is the monitor. So everything comes, and then of course, when you provide this funding, you leave it to the governments to provide the funding for respective organizations. So what is required is the monitoring and this sponsoring. That budget itself reduces substantially, and then the global team which would lead this R&D can actually make it happen. So this is what I feel from my side, that we really need a coordinated effort and a detailed agenda. A core team should be there which could connect to these respective R&D organizations in respective countries, and then present the agenda to the government. Because we know that the BRICS TB Research Network, we have seen the governments are committed for TB R&D. They've clearly in each UN high-level meeting and various meetings, they have actually committed. but they need a plan to sanction the budget. So this is what is our experience, and this is what I would like to say. Thank you.
Thank you for that. And I do agree with you. And I think the strength within the BRICS TB research collaboration should be further used to actually assist in finding those kind of solutions. Mike, over to you.
Thanks very much. And yes, Manjula, you're right that we have seen TB R&D funding increase substantially in India over recent years, and ICMR alone has really kind of shot through the ranks of top funders to be one of the largest funders globally. And if you add on what the larger Department of Biotechnology, Council of Science and Industry spends, it's even greater. So we do have these, bright spots, India being one, Government of Korea being another, where we see increasing investments, and hope that other countries follow. And you made a point about kind of developing an agenda and presenting it to government and making a compelling case for it. And I think it's a good transition to our third panelist, who is Dr. Nick Menzies. He's an assistant professor of global health at the Harvard T.H. Chan School of Public Health and Harvard Center for Health Decision Science. And Nick uses decision science, economics, and mathematical modeling to understand the consequences of policies related to TB and other infectious diseases. And Nick, a piece of work that you're involved in now is kind of putting together the full value proposition of new TB vaccines, which I think is a critical piece of making the case. And my question to you is then, in advocating to close the financing gap, how do we better understand and convey this full value proposition of what a new TB vaccine would offer? And if you could tell us a little bit about that work that you're engaged in. Thanks.
Thanks, Mike, and thank you, Glaudina. Certainly, I think to answer that question, the first thing is to understand the full breadth of health and economic benefits that will be generated by an effective and effectively implemented TB vaccine. Like, most importantly, there'll be the reductions in health burden of a disease that's been, and until last year and likely after next year, the major single cause of infectious disease deaths globally. And although that is a loss, I think it is important to recall these types of things for advocacy. And not only, during the course of TB disease, but knowing that individuals who survive TB over the course of their lifetime will continue to experience impairment due to the damage caused by TB. Another source of those benefits are the economic impacts at the household level. So we know that through the course of seeking and receiving TB care, individuals with TB and their families experience major costs and sometimes catastrophic costs associated with that TB disease episode. And again, after the TB disease episode, if they do have ongoing impairment, there's losses in productivity over the lifetime. And so these are can contribute to concentrating inequality and ill health and low economic outcomes in the already poorest parts of the community. As we all know, and might already be salient to others, there are costs at the health system level due to both treating TB, diagnosing TB, and providing care through typically primary healthcare systems to those who have long-term chronic impairment. Less well understood, but still useful to keep on the list of consequences we think about are the macroeconomic effects. That is to say, TB has such an impact on individual productivity, such that when we add up the effects of all those lost ability to participate in the workforce, then there are impacts at the country level in terms of things like gross domestic product. Certainly, that is something that's less well understood and practically is harder to study, given that a very feature of TB is that it has been with us a long time and hasn't really changed too much and too fast in a lot of countries. So it's hard to say, well, what is the macroeconomic impact of TB if it's kind of always been with us? But certainly we know that it should be a large impact given what we know about the microeconomic implications, again, at the individual and the household level. So that's certainly understanding where all of the losses associated with TB and therefore the benefits of TB vaccine lie, and sort of all the domains into which they fall. A second important step is to understand who is going to benefit from TB control. And most immediately, I think we should think about, the individuals, communities, and governments in highly impacted settings. But important not to forget that there are going to be benefits globally. First, through the fact that we have an interconnected world. Individuals developing TB in the United States, in Australia, in the United Kingdom, a lot of those individuals might have been exposed to TB in a high burden setting. Certainly most of the TB cases we see in low transmission, high income countries are amongst individuals born abroad, such that improving TB control in high burden settings is going to improve TB control globally. Most of the sort of TB control budgets in these high income countries are going to be sort of positively impacted if we are able to successfully develop and introduce a TB vaccine. Secondly, antimicrobial resistance, expressed as MDR TB and XDR TB are a global health threat, just as important and just as salient in some high income countries as they are in low income countries. And so I say that because I think there was a question in the chat of asking how we can sort of communicate some of these sort of impacts to sort of countries where they might not appear so meaningful, so salient. And I think that is the real challenge. And so in the work that you described, Mike, we are essentially sort of taking on that accounting challenge to say, well, what are this sort of breadth of benefits I described, and adding up how they would accrue over time, if we can sort of do as we hope to do and sort of develop and implement a effective vaccine. But I think the most important step will be understanding how to communicate those benefits. I have a feeling that if, say, the global number of TB deaths today was actually double what it actually is, right? I'm not sure our current position would be any different, because the number's big enough. We know that TB is a major cause of the burden of disease, and yet there still hasn't been this rapid expansion of funding as we've seen with COVID-19. And certainly they are different diseases, but I think with TB, we're falling into a number of, I guess, cognitive biases and sort of myopia due to the fact that TB has been with us for a number of years. The point's been made that it generally affects countries that have lower income, and within each of those countries is affecting the poorer and more marginalized communities. And so we already have a number that's big enough. The key issue is how do we communicate, firstly, the urgency of new action, and also the fact that we now have or hope to have a tool that can achieve real change. So I do see our task as important in terms of enumerating the magnitude of all these benefits, but I think that the key step comes, in what you do with those numbers in terms of making it, I guess, real, making it salient to people that this is the time to act.
Yes. 1.5 million deaths a year is already a staggering figure. It's unbearable to contemplate that could go up, actually. So thank you for that and for answering some of the questions that have been put into the Q&A. From enumeration and accounting to banking, I'm very happy to introduce our next panelist and to say that we have a banker on the panel about financing, which I think is essential. So Shiva Duster has over 25 years of experience in the financial industry, working for a range of private and public institutions in New York, London, Luxembourg, and is currently at the European Investment Bank, the EIB, which you joined in 2003. And you've worked in a variety of roles: risk management, lending, investing in innovative companies and corporations. And you're heading now the Innovation Finance Advisory Division of the EIB and working on TB and infectious diseases more broadly. And so from your kind of role in an investment bank supporting TB vaccine R&D, I'm curious to hear what are kind of some of the innovative financing mechanisms that the EIB is using or considering to support research in this area. We hear a lot about innovative financing mechanisms, and if you can help us concretize what that means, that would be great. Over to you, and thank you.
Excellent. Thank you so much, Mike. And indeed, I'm the odd one out here, but I have to say I feel very much at home in this community because even though I'm not a scientist, but I have had over the years a lot of interaction with TB experts from all over the globe, and I'm going to tell you why it makes sense for a bank like the EIB to actually be in this space and what we have done. So let me maybe take you back in 2009, TBVI, and I would actually even like to name the person, Joris van der Putte. I don't know whether he's listening, but I would like to give him credit. He actually found his way to the EIB and was already then telling us, you know, TB is something that the EIB had to look into. We were, I guess, mesmerized, to put it this way. Many of us had to really look up what it meant and what R&D in TB entailed. But it was the persistence, and I think, you know, the persistence and the perseverance of TBVI to really help us better understand. And I would like to here also give credit to the European Commission. And what we did, it took us a few years, but what we did is actually start with TB. And this is perhaps the story that there's a happy end, but there's also a sad tale. So it triggered in us the idea, well, the EIB as Bank of the European Union, you know, we need to find a way to help the European Commission to have an alternative way to use their budgets to just grant funding. And this was the starting point. We effectively did an sort of a study back in 2012-13, trying to better understand precisely the sort of issues that Nick has raised. You know, how could we justify from an health perspective, how could we help make the case, you know, to our to the ministers of finance, you know, and get sort of people to better understand the benefit of prevention versus, you know, of not doing anything. So all of this led us to a view that indeed it made a lot of sense to start a pilot. And this is what happened. So in 2015, under the Innofin program, which the European, under Horizon 2020, there was a major financial instrument, so a program that the EIB is running on behalf of the European Commission. And there was a pilot sort of instrument called the Innofin infectious diseases. Now, you right away hear infectious diseases. So what happened is we started with TB, but then realized this is a bigger problem. And this instrument needed to have a variety also, you know, ways to, you know, fill the pipeline. So it was broadened. Now, the happy part of the story is this instrument has actually been extremely valuable for the bank and the European Commission. In the last, since 2015, over 520 million or so of financing has gone out towards 20 or so operations, supporting project costs of around 2 billion. Now, if you now could ask me, but how much of it has gone to TB vaccines? Because that was the original idea, right? You know, when they came knocking at our door in 2009. Well, what we have right now is a recent operation that, you know, was basically towards life-threatening you know, bacterial diseases. It's a Swiss-based company called Bioversis. They received 20 million and they have some TB activities. But unfortunately, the infectious disease financing facility has so far not yet had any other TB vaccines in its portfolio. It has had a lot of other things, HIV, better flu vaccines, antivirals, and, you know, AMR. But not TB. So that's maybe one thing. The bank has used another instrument to support a Serum Institute sort of vaccine, TB vaccine for infants, with a 30 million loan that was provided to the Serum Institute last year. But okay, you know, this was again something that was done, which is of course very worthwhile. But why have we not done more? And perhaps the issue very often that we have faced is, where are the TB vaccine companies that have products that could actually that could benefit from this financing? And what perhaps I should maybe highlight, yes, a typical bank or an investment bank would not be able to come into these projects. The reason that EIB has managed to do so is, as I mentioned to you, these are we're basically comparing grant funding, which would be, the minute it leaves the door, is 100% lost. You will never see the money. The infectious disease financing facility has a situation that the money goes into a project, into a company, and again, I highlight a company. It's not a collaborative project. It's somebody who's on the hook, a company on the hook. However, if for whatever reason the project fails, then the money is not repaid. But if it actually succeeds, not only is there repayment, but there's also some return. And this money then flows back into the system. And this is why, whilst we are effectively having a full guarantee from the European Commission, they have the benefit of this portfolio having, also through the diversity of activities, and therapeutic areas, having a good chance of many of these projects actually doing well. Some will always, undoubtedly fail in that risk category, but you're still better off than if you had put 500 million as grants and never seen the money again. And therefore, I would like to leave you with the notion that, really from a public policy perspective or public financing perspective, we have a good track record. I really do hope that under the next MFF, this instrument of infectious diseases will remain supported, get additional funding. I would like to say that it was, for the European Commission, very useful a year ago, or in March 2020, to have the Innofin infectious diseases, because 75 million went rather swiftly towards CureVac. I mean, we all hope that CureVac will finally get its vaccine out, but just to give you a sense of having an instrument like that, you can mobilize it rather quickly. And then coming to TB, I really like the way Luchika was referring to people don't know what the problem is. I would say what TB issues are. I would say people don't know what they don't know. I mean, many of us don't even know that we don't know that there is really a problem out there with TB, and that I would hope that with the narrative somehow can change. And I fully endorse all your self-reflections on being bolder and really putting the health authorities to question whether their lack of preparedness for the COVID should just be, a cause to continue to be not prepared, because clearly, the fact that it has not novelty value should not reduce the impact that it nevertheless has, as Nick was saying. But that narrative is missing. I still to this day feel like when I refer to TB vaccine being the origin of our IDFF, I don't have the narrative that makes the case. So I would hope we can develop that, because it would be a shame if instruments like that cannot support more projects.
Really interesting, thank you. I'm gonna turn things over to Glaudina to do the first question, but since Shiva, you mentioned Luchika and this point about narrative, I just wanted to see, Luchika, if you wanna say anything else about kind of the narrative aspect of this. And I know you may not be able to stay with us till the end, so I wanted to give you the opportunity now, if you want to take it.
Yeah, I can take it, but can you just, so I will stay, actually, it's very exciting, but can you just repeat the thing? Because at the point you froze here.
Oh, sure. Shiva was making a point about how we still lack a kind of narrative to make the case that we need to make for TB and TB vaccines in particular, building on the point that you raised about kind of the communication story being incomplete. This idea that people still don't know that we don't have a safe and effective, affordable vaccine for pulmonary TB in adults and adolescents. So what kind of narrative work do we need to do, and is the Stop TB Partnership maybe doing in this area in particular?
So I think we have the points to, okay, sorry, I didn't know what happened with me. I think we have the points to make. we have the points to make. We know the costs. We know what it means. We know why do we need a vaccine. We know that we cannot end TB without a vaccine. The problem that I want to say, what I think is the problem is this: maybe packaging it in a huge campaign, and this and you know, targeting somebody. I think it was Patrick Bertrand, our friend from France. He packaged it like reaching people outside our bubble, you know what I mean, outside the TB community. And this is something for the last few years we tried in Stop TB as well, because, you know, we have once a year we do this TB day in which everybody is pushing. And, you know, this year we spoke about the 100 years vaccine and so on. But the metric should not be how many people we reached, you know, which are also our colleagues, our peers, union people, tag people, TB proof, you know what I mean? We tweet ourselves between ourselves. So we said we should reach outside. This year was the first time we reached 102 million people together. Okay, so which was huge, first time ever in our lives. That should be our metric. So it's basically designing campaigns with them. I mean, we have the information. It's not packaged for the right audiences outside the TB bubble, which should be normal people. So this is, you know, and then should be potential donors that can come in it. So we should not go to the usual suspects. We should not go back to Gates, USAID, European Commission, even, as you know. We should go for people that are from outside the TB community. And so that's one. Now, I tell you, and I'll be very honest, what is the challenge for this? So we are very keen to jump on it and to do whatever it takes, because I have to tell you that for a long time, I thought that we are overstretched with the budgets. I was hit as well by this shyness in a way. When I saw how countries mobilize the money to put into TB and in the COVID, with what you were saying, Mike, 80 whatever billions, 240 candidates in the pipeline, how countries mobilize to have live data for COVID. I know it's not our topic here, but you know, if you had on the screen of TB, the number of people that die with TB compared with COVID in some of the countries where TB kills even today more than COVID, of course that people will be outraged, but we don't have these figures. And in a matter of days, Nigeria, Ghana, DRC, countries that you say, oh my God, they need their support, we're able to have live data on COVID by district, by gender, by age group. So it is possible. So now that we saw it's possible, we should be unleashed. What is missing for us is that to do a campaign, as I said, that is not enough to have us. You know, we need to do something very solid to be united and so on. And usually we don't have this kind of resources. You know, you put 100,000 in a campaign, you get, usually you say get 10 times more. Even if you get 20 times more, it's not enough. So you need to make a campaign of $10 million that you spread it globally, that people are like hearing just TB and vaccine and whatever other things we have there. And then you will see that people will be like, huh, it's happening. So that's what we should probably be able to fundraise. We in Stop TB, we are actually pushing, we are going to push a lot on the R&D and vaccine. I have to confess, driven a lot by the fact that we saw it's possible. So thank you, Mike. I'm actually going to stay. There were a few moments in which I told people that actually this is very important, and I cannot say how committed we are if there is another call about Stop TB, so that is going on, but I told them that I want to stay here. So thank you.
Thanks for being with us. And yes, I admit that as an advocate, I was affected by the shyness too. You know, I feel like every time we've asked for a number in front of somebody who controls a budget, we get a pause and they're like, do you want to add 3 zeros onto the end of that? You know, are you sure that this is big enough? So I think we do need to be bold, and point well taken. Okay, Glaudina, over to you. And I know we had a panel member who wasn't able to join us, and maybe you want to say a note about him and then ask any questions from your side.
Yes, it is a pity that Dr. Clomo could not actually join us in this discussion as such, but unfortunately it seems he's not able to connect. He's been a very great supporter of TB research, and especially in the context of South Africa TB and HIV research. And he's now a member of parliament and the head of the National TB Caucus in South Africa. So it's a pity that we will not be able to listen to his insight into this whole thing. So one of the questions that was asked is, how do we actually include TB in the current epidemic preparedness political momentum? How can we actually benefit from the awareness, the money that's floating, and what is the panel opinions around that? How do we utilize the current epidemic preparedness awareness and to make it then for TB as well? Any panel member?
Yeah, so this is Nick here. And so I think that is a good question. Certainly for, we live in a different world now. And so we should be considering all of our arguments in light of the current pandemic. Certainly, I think, it introduces major challenges, but also I think, understandings, and I think there was a point made of, speaking beyond our circles. Certainly, my children know epidemiological concepts now in a way that I did not expect a year ago. And so certainly the understanding of what infectious diseases mean is, I think, much broader now than it used to be. And so I think we should leverage that. In my initial comments mentioned, concern for antimicrobial resistance as something that could be used. I, at the same time, think we should be careful about those kinds of arguments in terms of, while they may be a way of generating political concern, they also can be a way that we stigmatize a disease and individuals with the disease in a way that we don't want to do. So I think while that is one route, I think I'm not sure it's it should be a main pillar of the argument. What I think should be is the fact that people have this simple example of having a major infectious disease where there has been success in controlling it with a vaccine, which is hopefully something that would resonate with a lot of people fairly directly.
Thank you, Nick, for that. Any one of the other panel members comments?
May I just come in?
Yes, please, go ahead.
Yeah. No, I perhaps maybe one other reflection again from maybe the banker in the group and not the scientist here. What is also interesting is, because there is BCG, there is the wrong, I think absolutely wrong, I think from a scientific perception. Well, we have a vaccine, and aren't we actually protected? Because, people don't realize that maybe these vaccines or haven't in the past. Maybe now with the COVID, they realize, you need boosters and you need continuously to be vaccinated. But so there is also indeed the problem of, I think, as many of you were saying, TB has been this old disease. It has, people just figure you just live with it. And then there's this vaccine. People don't know that you're not protected. There is indeed a real educational gap or information gap. And I'm just wondering again, do you have any, does the TB community have any influencers, as our kids would call them, social media influencers or celebrities that could maybe, make the case on your behalf? That's one thing. The other thing is, what is interesting to me, almost nightly, we have epidemiologists on TV, whether it's CNN, BBC, and so on. They, of course, all answer the questions of COVID, but I'm just wondering why this is perfect airtime that people have. Why aren't they raising more awareness that, there are other diseases? Maybe they have, and I just haven't listened to those. So just a few reflections.
No, thank you for that. Mike, over to you.
Thanks. So we have about 10 minutes before we have to wrap up, because we have to end 2 minutes before the hour so that the final closing session can start. We said that we would ask each of you to give a closing reflection, sort of putting you on the spot, but recognizing that, okay, in 12 months for COVID, we developed these multiple incredibly effective, safe vaccines, and the job is not done, but it's a remarkable achievement. And in TB, we're celebrating the 100-year anniversary of BCG. We're used to thinking in terms of decades or centuries, even in terms of our progress. So if you each had to name one essential action to accomplish over the next 12 months, not the next 12 years or the next 120 years, but 12 months, what would that action be and who should take that action? And in terms of the order, Manjula, if you don't mind, maybe I'll go to you first for your thought on the essential action. Thanks.
So thank you, Mike. I think for one action that is required, we all know we have the candidate vaccines in pipeline, right? We all know what are in what can go into phase 3, looking at the promising results of phase 2. We should come together, the vaccine developers or the global players, maybe, the WHO or, Stop TB Partnership should take a lead in consolidating the global efforts, connect to the BRICS TB Research Network or to the, the lead research organization of a particular country, and give the responsibility of consolidating national efforts in generating the national funds for their national sites to that organization. This is what will take care of the finances for that particular country and reducing the financial burden on the central agency or the global agency, which is consolidating the global efforts. This is, I think, is required to undertake the phase 3 TB R&D, the POD vaccine trial. And it will not only save time, but also reduce the financial gap that we are talking about. So this is one action point which we should immediately start. The preparing of the protocol and taking into consideration the countries that would participate in this is very important, because the country research organization can also take care of its regulatory requirements, which are specific to each country. So this uptake, if the results are promising, the uptake by the country will also be very fast. So this one action point that global players should immediately start would be, forming a global team, a core team, connecting to the lead research organization. And I think BRICS TB Research Network would be one such body which will connect straight to the 5 countries with high TB burden. So this is something which can be led by the global team, because in India, we have seen, we are leading the efforts in India. We have our own results, and we've completed the recruitment of 12,000 participants in the COVID time. So we kept on working even when there was entire lockdown in the country. The team which was doing the TB vaccine trial was continuously working, convincing people to come for follow-up. So we completed in December the enrollment of 12,000 participants, and the follow-up is on. We might have a vaccine at the end of this year. So it all depends when we reach our endpoint. So this is something which can be easily done by our global core team, which could be formed, and immediate discussions could start. Discussion do not need funding. This is what I feel. We can immediately start, prepare agenda, consolidate, make a team, delegate the task. Okay, you prepare the protocol, consolidate people, bring out the teams, prepare the sites. This is what is required. Ultimately, even if you have funding, if all these things are not ready, you cannot start a clinical trial. So I think this is one action point which could immediately start without wasting time while we generate funds, from separate countries, and also, for the central team.
Great.
Thank you.
Thank you, Manjula. A quick note that the closing session starts immediately after this. You can stay on the line. You don't have to relog into Zoom or through the platform. So don't close your window to the audience, just stay right here. Okay, Shiva, let's go to you next. And if I can ask you for the brevity of one action in 1 minute, 1 minute and a half, maybe.
Okay, well, I keep it simple. Get more money, get more capital or a guarantee so that our infectious disease finance facility has actually the means, and really do, and this is my advisory, therefore, where I would make sure that our advisory proactively goes and finds also TB candidates for this new financing budget that we would get. So I would like to ask all of you to make the case with the European Commission and the member states that the IDFF is a successful instrument. Let's keep it. It's the wrong time to not have it.
That's very clear. You've given us something to advocate for. Okay. Nick,
Thank you.
Hi, so I'm an academic. We can't think of anything being completed in 12 months' time. But I think one key initial step, I think, for me is to having reflected during the current pandemic about how I'd been viewing TB previously, it is to lock in the sense of urgency that, societally we've felt with COVID-19 and know we're in exactly the same scenario with TB, that there is a clock ticking and we should act accordingly.
Beautiful. And thank you for minding our clock. Luchika.
So first of all, this was so great that I am very excited now and agitated. And thank you so much, Shiva. We have some influencers. We worked and we have influencers at country level, and unfortunately in countries with high burden. So, they are not so there we can push a lot of stuff, but I will not go into this. I just want to say that because the point that was made was what we do in a year and so on. So I want to say two things. One, I already appreciate how you started, Manjula and Nick and you. You kind of said different, we all have comparative advantages. So it's like, let the researchers do the research work, let them come together, advance the candidates, keep enrolling. So from our side, I actually want to put, and Mike, that should be our job, and I am keen to actually speak with some people to put a vaccine campaign of at least $5 million over the next year, and the vaccine the line should be get a TB vaccine by 2023. We plan to have a UN high-level meeting in 2023 at the end of the year, and follow up of the one in 2018. So we should run with that figure. And I agree with Nick that I'm also very much a technical, right? So very often you are like, really nothing can be done in 12 months. But I don't want to accept that, because we saw that we rolled our eyes when we heard about the COVID, and I was among those saying that's impossible to do something even in a year and a half. So we see where we are. So that should be the main line. One thing I want to tell for all of us, and Shiva, you said something very good. When you asked about do we have the messaging and so on, when Mike asked, I said yes. One message that we need to craft well is the one around BCG, because indeed there is a BCG. So you know what I mean? When people come and say, oh, but I heard about BCG, it's like, okay, it's 100 years old. And then you go with all this technical explanation and helps just children in endemic countries. By the moment you start that, you lose people. They are like, okay, you have something, maybe it doesn't work well, but there is something. So we need that something. And also there is this work with the BCG to ramp it up to whatever. So you know what I mean? You go too strong and say, we don't have anything, people are getting. So that's an area in which you need to get the narrative straight between all of us and so on. So I can speak like this so crazy a lot, but I feel like we should do something. So we should continue. And I'm really honored that I met you all. And I think I know others, but I didn't know you, Shiva, for example. So great to meet you. And thank you all.
Great. Thank you, Luchika. Glaudina, any closing thoughts from you? I'll leave it to you to close.
Thank you for the inputs. And I think there's a lot of thoughts on what we can do and use the different fora that is in place to actually really start putting together. I know from the BRICS side, we will definitely look at how we can actually make use of some of the suggestions as such. So thank you for your participation. Thank you for listening to the panel members. And now over to the final closing of the forum. Thank you.